Hey everybody, it's Heather. I'm going to make my video today about my bilateral breast biopsy and just share with you my experience that I had through that, and in case you're wondering what that's like or if you have one coming up, maybe it'll help prepare you, and maybe I have some advice that might help you to not be so nervous and maybe help you to get through your procedure better. So I had mine done on January the 19th, and I had a bilateral, so that's both breasts were biopsied. And it's basically the same routine as for a mammogram or an ultrasound. You take everything off from the waist up, you have the gown on, and you actually, I went into the same room where I had my ultrasound done. So it was done in the same exact room. There was the radiologist and 2 techs were with her to do my biopsy. And it's ultrasound guided, so you have the ultrasound, they're using the ultrasound probe, and then it's guiding them to find out, you know, if they're getting the area that they're wanting to get. So you'll see all of that when you go in the room. And you basically lay down just like you do for an ultrasound. For me, they started with my right breast, and I had my hand behind my head, and they put a cushioning pillow at your side to kind of prop you up to, you know, however they can view it best on the ultrasound screen. And they clean you with they clean me with a betadine solution. It looks like a really bad tanning, a really bad self-tanner, but it cleans you and keeps your skin sterile. And they drape you with these cloths to, you know, help prevent infection. And there's nothing between you to block your view from seeing what's going on. So if you're squeamish when it comes to needles, you might want to think about that, and try to find something in the room to focus on. I'm not really afraid of needles, but I think anybody in that situation, I don't think you'd want to watch it. So I just tried to focus on something on the wall and on the ceiling and think about things that I wanted to get done at my house and things that I wanted to do later on. I just tried to think of things like that to get my mind off of it, if that was possible. But that's how I dealt with it. So basically, after they clean you and they drape the cloths around you to keep it sterile, they have this machine, and it's the core needle biopsy machine that just takes the tissue out from the tumor. So they will nick your skin. It's just a little nick, it's nothing big, and you will be numb. They give you numbing shots. They gave me lidocaine, so you won't feel it. You'll get some shots just to numb you, and then they'll give you a little nick so that they can get the biopsy, I don't even know what it's called, but I can't remember, but it's the core needle biopsy instrument, so that they can get that into your skin and get down to the tumor, the area that they're suspicious of and that they need to get tissue from. So when my radiologist was doing mine, before she nicked me, of course, you know, she numbed it pretty well. And on my right side, I think she gave me maybe 2 or 3 numbing shots. So I couldn't feel anything. And she asked me, as she put the core needle biopsy instrument inside, she inserted it, she asked me, can you feel anything? And I was fine. I couldn't feel anything at all. I did feel some pressure, but it was nothing that, you couldn't bear. You can watch on the screen, on the ultrasound screen, you can watch that as it goes down into the tumor if you want to watch it, but I didn't really want to watch it, so that's up to you. But you will hear when they take tissue out, when they get down to the area of the tumor where they are wanting to, test it for cancer, you will hear a clicking sound. And that's just it, kind of cutting out, scooping out some of the tissue. They took, I believe, maybe 4 or 5 samples from my right side, and they put it into these little tiny jars that are filled with a liquid, and that's what they send off for your pathology. After that's done, I'm trying to go back and remember exactly how they did it so I can tell you all the best of my ability. After they did my right side, it was time, to move on to my left. But the tech had to hold down pressure on my right side to stop bleeding. So before, I should have told you this at the beginning of the video. I'm sure your doctor will go ahead and tell you anyway, but to kind of prep yourself for this procedure, you don't need any type of blood thinning medication, blood thinners, aspirin, ibuprofen. You can't take fish oil. So any medication you're on that could, possibly thin your blood, you need to stop it 2 days before your biopsy because you don't want to bleed more. And I did stop mine, but it still took a bit of pressure and time for them to hold the gauze onto my incision to stop it from bleeding. And once the bleeding stopped on my right side, they bandaged it up, and then it was time to move on to the left side. And I did look down when it was bandaged up, just to see, and it really didn't look that bad. It wasn't anything, intimidating or scary. So I was ready to just go on with the next one. So again, they're moving on to my left breast, which is the one that she was initially suspicious about. And I'm not really sure if it's because the place on my right breast was right near the surface, but the left breast biopsy hurt more. I really wouldn't call it really wasn't painful. I think it's where it was deeper into my breast that caused it to not be as easy as my right one. I could not feel my right breast for probably 4 hours after this procedure. And I was that numb on my right side. And on my left side, the radiologist, well, the tech, scrubs your skin, cleans it, and then drapes the towels around you, and then it's time to make the incision. Well, first she numbs you, of course, and she numbed me, and then she made the incision, and then when she was sliding the core needle biopsy instrument inside, I could feel it. I could feel like a big needle going inside of me, and she was very, very careful and very concerned with my comfort. So she kept asking me, can you feel anything? Are you okay? And when I felt that needle, I told her, I can feel that, because I didn't want her going any further with having to deal with that pain. So she said, okay. And she pulled it out, and she gave me some more shots, and then she started again and put the instrument back inside, and she said, can you feel anything? And I couldn't feel anything, but I felt more pressure in my left side than my right. And again, I say that's most likely because the tumor was deeper into my left breast than my right breast. So the pain level, honestly, it's not painful. The shot was not painful. It wasn't even like a bee sting. The actual procedure was just pressure. It was not painful. After that was over, she took probably, I think she took several more clips of tissue out of my left side. And when she was finished with it, the nurse, was holding pressure to my incision on my left breast. And I asked the radiologist if I could see it. I've always been curious of things like that. Anytime I've had to have surgery, I've always wanted to see whatever it was. Just, I don't know, just curious. And she brought it over to me, and it was in a small jar, and it honestly looked like little tiny pink and white worms. That's the best way I can describe it. But I did get to see what it was that she had took out, and she had several samples of it to take out. Once the nurse, the tech had got the bleeding to stop, she bandaged me up. And then they had me just sit on the edge of the ultrasound table just until I could, they knew I wasn't going to pass out or anything until I was able to walk. And I will tell you that they leave a little coil-shaped thing inside of you. Wherever they take the tissue from, they leave that inside of you so that when your pathology results come back, if it comes back that you have cancer, then the surgeon will know what area they took from, and the surgeon will see those little coil-shaped markers inside of you. And so they put one in both of my breasts. They put the coil-shaped markers. Now, one part that was a little bit, I don't know, it wasn't painful, but it just it was uncomfortable, I guess is the best way to say it, is after they did the biopsy, they do a mammogram, which is really probably not the best time to have a mammogram after you've, been cut and all that. But they did a mammogram, and they do that basically just to see if the coil-shaped, if I'm saying that right, markers are where they wanted them to be, because they want your surgeon, if you have to go that route and have surgery, if it is cancer, they want your surgeon to be able to find exactly where they took that tissue from, so they'll know exactly where the cancer is. So they do a mammogram, and it's uncomfortable. It's not painful, but it's uncomfortable because you've just been cut, and you're sore. So after the mammogram, and they make sure everything's where it's supposed to be, they will take you back and help you to get into your bra. And before I had this procedure, I looked at several different places for a good sports bra. I have some sports bras, but I wanted one, and I recommend, if you have to go through this, or if you're facing, surgery, I recommend getting a front zipping bra, because it is so much easier. I wore mine. I bought some off of Amazon. I'll put a link in the description video of the ones that I bought, and they were wonderful. And I think I got 3 for under $20. I'm pretty sure. But they were really wonderful. They gave me a lot of support, and the only thing is, there was one that was pink, and you usually wash things before you wear them, but I would if you wash your things before you wear them, wash that one alone, because the dye did come, some of the dye did come out of it. I mean, it's still pink, but whatever you wash it with, it's going to have pink dye on it. So I would just make sure you wash that one individually if you order those, but I highly recommend them. I brought one of those with me to my biopsy appointment and put it on, and then the nurse had ice packs, and she just stuffed me full of ice packs. So the biopsy really wasn't that bad. After it, actually, I was with my mom. She went with me, and we like to go, to thrift stores and look around. And we went to, I think we went to Hobby Lobby and to a fabric store. I think we went to Joann Fabric, and we went to Goodwill because we always try to find, something for a good deal. And one funny thing, we went through a drive-through restaurant, Pal's, and just to get a gallon of tea. And they told me, don't lift anything over 5 pounds. No, don't lift a gallon of milk, is what they said. Don't even lift a gallon of milk. And don't take a shower for 24 hours after your biopsy. Leave it dry. Then you can bathe. Well, anyway, back to my story. We went through the drive-through to get a gallon of tea, and my mom, I guess we had just been, out shopping, looking around, and she was driving, and she got the tea and then handed it over to me, and I said, I've just had a breast biopsy, and you're handing me a gallon of tea to hold. But it was funny. It's good to laugh, when you have things like that going on, try to find humor wherever you can, and try to be around people that try to laugh and have fun, because negative people can really drag you down. So if you have to have an appointment or a biopsy, anything like that, regarding breast cancer, I hope you have somebody in your life that you can laugh with, even when you feel like crying, because that's really the type of people that, will help you the most get through it. So if you have one coming up, basically I would just say, get a good sports bra, and of course, follow your doctor's directions about medications and things. But it's really not that bad. I did bruise a little bit. I had some yellow bruising, but it wasn't anything bad, honestly. I kept the ice on it only to help with swelling, and I didn't have any issues. So I hope that if you have a breast biopsy coming up soon, I hope you have wonderful results, and that you heal well, and I hope everything comes out good for you, and I hope you have great care, a great team around you, and a friend, family member, somebody that you can laugh with, even if you feel like crying, even if you're scared. I pray you have that in your life, because it will make it a lot easier for you. And just take it day by day. That's all you can do. And I will tell you, the hardest part of the breast biopsy is the waiting for your results. It took 3 days, 3 days for my results to come in. And they told me it typically takes 3 days. The third day after my biopsy, I called the breast center where I had it done, and the receptionist that answered the phone, I told her my name, my date of birth, and I said, I'm not calling to get my results, because I know you can't, discuss that over the phone. I just need to see if my results are in. And she was kind enough to look up my records, and she said, they're in. And I said, well, could you please have them faxed over to my primary care physician? So she said, I'll do that as soon as I hang up the phone with you. So after she did that, I contacted my doctor, and I told her that I had talked to them at the breast center, and they said that my results were in, and she said she would be looking for them. So, hold on a minute. My mouth's getting dry. So she said she would be looking for them, and this was about 12 o'clock. And this was on, I think it was on a Friday. No, it was on a Thursday. So my doctor's office goes out at 4:30. And I figured, if it's good news, she's probably going to call me soon and tell me, because I'm sure she knows, that I'm pacing. I'm just so worried and just nervous and all the feelings that you would have in that situation. And, 1 o'clock, 2 o'clock, 3 o'clock, 4 o'clock came, and I had not heard from her. So I just, kind of put the pieces together and figured it's probably not good news if she's not called me by now, because I believe she would have already told me if it was nothing to worry about. So I had an alert on my phone that I had like a Zoom call from my doctor. And now, remember, this is during the COVID period, where a lot of doctors are just seeing patients, having like phone visits with them instead of in person if it's not necessary. And in my case, it really wasn't necessary for her to tell me in person. So over the phone was fine with me. I just wanted to know. And I ran upstairs and I went to my bathroom so I could be by myself. And I talked to her, and she told me it's not good. She said my right breast, the one that I initially had the marble-like place in it, that it was nothing. There was nothing to it. It was a fibroadenoma. And then in my left breast, she said it was invasive ductal carcinoma with lobular features. So basically, that means it's a fast growing and fast spreading cancer, and that it needs to be treated quickly. And if you've had that diagnosis, you understand the feelings that come with that. So I cried a little bit. And when things happen sometimes, really hard things, sometimes you feel like God is far away from you. And sometimes you wonder, like I had told you before in my previous video, I had so much stress on me that I didn't think I could handle anything else. And then, I hear that I have this fast growing, fast spreading cancer. And I know I'm a Christian. I've been a Christian since I was a little girl, but I'm real. And I know that just because you pray certain things, just because you live a certain way, doesn't mean everything you pray is going to be answered. I don't believe that way. I don't believe the Bible teaches us that way. I believe you can look at the lives of many people who love the Lord with all their heart and see that they went through really hard times. So if you have this diagnosis, if you're going through breast cancer, you really just look at stories from the Bible of people who suffered but who loved the Lord. And if you don't believe in God, you know what? He still loves you. that doesn't change his feelings for you. He loves you and he cares about you. And he cares about your fears, your worries, your concerns, he cares about all of that. And he wants you to give him all of that. So whether you're a Christian or you're not, God loves you. And he wants you to come to him with that. That gives him pleasure and delight when we confide in him and when we come to him and lay our troubles and our worries at his feet. And if you are going through cancer, breast cancer, I just want you to know that even though it may feel like he's not with you, it may feel like he's far away, trust me. I know that feeling. And that's a story I may share with you in another video, but I know that feeling of knowing that he's far away. But he's right there with you, and he wants to be the one you confide in, the one that you talk to. He wants you to tell him you're worried. Tell him, if you're angry, tell him he can handle that. He can handle all of your emotions. He gave you those emotions. He created you. So you just rest in knowing that he loves you, and that even if you have hard times in life, he will never leave you and he will never forsake you. And he sticks closer than a brother. And in those times when he feels so far from you, he's there, and there is a purpose. There's a reason. And we may not know it this side of heaven. We may not know the reason for things that we have to go through, but the Bible says that God, can work out. He will work out all things for our good. So my advice is just get along with God. If you don't believe in God, if you don't believe in Jesus, then what would be the harm in just getting alone and talking to him and saying, Lord, if you're real, Jesus, if you're real, will you just reveal yourself to me? Just let me know. Because I don't know how people make it through really, really hard things without the Lord. And I know some of the kindest, most loving people that I know have been through really, really hard things. And it's hard to understand that. But we have to trust God's heart when we can't see what his hands are doing. And that's where I am. I know he loves me. I know that Jesus died on the cross for my sins. I know that he takes delight when I come to him and I pour my heart out. My confusion, my anger, my sadness. I've poured a lot of sadness out to him, and a lot of grief. He takes delight in that because he loves us so much and wants fellowship with us. So I advise you to do that, to get along with him and talk to him. And if you want me to pray for you, just leave a comment down below. Just remember me when you pray, or pray for me, and I will keep you in my prayers. Because as Christians, that is what we do for each other. And you need to know that you're loved, you're cared for, and I just hope that in some way that I can maybe just give you a little bit of hope and maybe just take a little bit of your load off of you, because I really try to tell you, whoever is listening, the things that I wish I had been told or had known about beforehand. I kind of think, I wish I'd known this, or if I'd had this advice or known about that, then I think it would have made it easier for me. And that's basically what I want to do. I want to do that, and I want you to have a place, to go to, and there's only one place that you can go to where you can find peace in the midst of chaos. So wherever you are in your life, whatever you're going through, maybe it's not cancer, maybe you came upon this video and it's something else that's troubling you. Wherever you are, I pray that you find Jesus in the midst of whatever situation you're in, because I promise you one thing: He loves you. He is for you. He's not against you. And He will walk right beside you through every